Nitric oxide, should we supplement? The informal topic, more of the clickbait kind of topic, is, can mouthwash cause erectile dysfunction? Now, wait a minute. We usually don't deal with that stuff on the channel, and what has all that got to do with anything anyway? Nitric oxide, why is it important? Should you supplement? Why is NO or nitric oxide important? Well, it is important. It was the subject of the 1998 Nobel Prize in medicine. What's it got to do with angina, heart attack, and stroke? What's it got to do with erectile dysfunction? What does any of that have to do with dentistry or mouthwash? Can mouthwash really cause ED? And there's a subtopic in there too, another subtopic, citrulline and arginine. In fact, as many of you know, I hardly ever cover the subject of ED, and it's on purpose. Here's why we rarely cover ED, because it is a big issue, especially for men's health and for my population. We haven't covered it in the past. We cover it very little, but we have covered it in a couple of videos. Why do we not focus more on it? Because most men start going down the path of testosterone. Testosterone in most states is a controlled substance. So yes, we could go there, and yes, it's a major issue for vascular health, but our major focus is vascular health. Getting involved in testosterone and controlled substances for a telemedicine group like ours, at least in the past, would have been a nightmare. Even now, when others are doing it, it still would be a major distraction. We are focused on vascular health. And if you look at our top 10, now part of our top 15 videos, 2 of them had to do with this specific issue, citrulline and L-arginine. So we're going to answer one of those questions now. Why citrulline and L-arginine? And why were they so popular? Because they are precursors of nitric oxide. As we'll learn a little bit more, nitric oxide has a heck of a lot to do with vascular health and therefore also erectile dysfunction. So back to the 1998 Nobel Prize, it was awarded to 3 people, Dr. Robert Furchtgott, Dr. Louis Ignarro, and Dr. Farid Merad, for their discoveries concerning nitric oxide as a signaling molecule in the cardiovascular system. You see, what it does is it relaxes the smooth muscle in the cardiovascular system. Still not ringing any bells? Well, you'll get there. You remember the intima and the media, you know, in terms of like the intima media space, that's where plaque is laid down. The media is nothing but that smooth muscle. It provides that structure, and it's a critical part of blood flow. And you'll see a lot of the ED commercials where they don't want to mention ED, so they'll mention blood flow. The intima is the lining. The media is that muscle space. Here's what this research led to. It was a breakthrough in terms of things like nitrates, nitrites, and may remember the old nitroglycerin for angina. Here's some pictures, if you're not keying in yet, the involvement of smooth muscle in our artery walls. This is a cross-section of an artery wall. This layering inside is just dried blood. This black area is that intima layer, very thin layer. These concentric layers of pink and black and white, they are all smooth muscle. Here's a diagram showing the smooth muscle and the intima. And here's some pictures that, if you've seen any of my other videos, they're focused on plaque here. But again, just a reminder, this is the intima, and that's the media, that muscle wall layer. And that's the plaque in between the two. You remember, this is a liquid plaque area. If that liquid plaque breaks through the intima, goes into the bloodstream, touches the blood, it can cause a clot. If the clot's big enough, it causes a heart attack. If it goes to the heart, if it goes to the brain, it causes a stroke. Once you start getting into the details, what I was going to say is it gets maybe more interesting than it sounds. But then, obviously, yes, it does, especially for men and for couples. Again, a big question. I rarely deal with it on this show because of the focus on cardiovascular health. But this was a video, and we're going to talk about how I ran across it It was actually on the forum. It's a Dr. Amy Killen, as you see, a young, thin, attractive, blind, who's doing a 1.5-minute video on is mouthwash ruining your erections. That's anyhow, for those of you who have an interest, where would you find that? Again, it's on the forum. And how do you find our forum? First, go to prevmedheartrisk.com. We've got 2 websites going on right now because we're in a transition. And I can tell you that part's a little bit painful, but it is what it is. prevmedheartrisk.com/home-1. Hopefully we'll clean that up over the next week or so. Go to the upper right-hand corner under More, and then go to the forum, and then search for Houston, we have a problem. If you get to the current website homepage, you'll see it in the upper right-hand corner, More. Click on that, and then you go to the forum. And again, you see why folks were dealing with this question. Let me go back and read it. It was from Tom Deck. He's a super moderator. And again, ED hasn't come up a lot on the forum, but it comes up because of the issue of vascular health. Here's an interesting video I noticed recently. The premise of the video is that bacteria in the mouth play a role in converting the nitrates that we eat ultimately into nitric oxide, NO. If we use mouthwash that kills those bacteria, we lose some potential for nitric oxide production, which ultimately is important for relaxing blood vessels to allow more blood flow to the places where you want it to go. The second reference explains how this conversion happens. So now you're beginning to get some of these connections. And obviously, once you understand those connections, you understand what this has to do with vascular health, heart attack, and stroke. So this gets back to some of the question of how Doug got involved. Doug had originally asked me about this. There is a group that has a supplement. It's called Neo 40. And they've been approaching Doug and other dentists, especially dentists like Doug, WDN dentists, the Wellness Dentistry Network docs, because they know that these docs understand nitric oxide. They're all about helping us protect vascular health. So the company visited Doug. They visited several other dentists. They said, we've got the greatest thing since sliced bread. Doug did what he often does. He sent that to me, and he sent the science. That's obviously where I tend to go. I went into the science, and here's a few questions that you should be thinking about as Doug gets into this presentation. Number one, is nitric oxide important? Well, obviously, I think we all know that. Here's the biggest question. Number one, should you supplement nitric oxide? And number two, if you do you really need to use this or other supplements like beetroot? Just plain old simple beetroot, 5 cents a tablet. Is that okay? So Doug, let me hand it off to you. And as you and I have talked, there's probably more topic than we can cover in our routine session today. So we'll cover a little bit. I'll monitor the question side, and we may have to go into part 2. Okay, go ahead, Doug.
Yeah, so where this got started for me, Ford, was in the whole idea that gum disease and gum disease causing bacteria can actually, the biology of the blood vessel. And this is where this took me. And I had patients asking me, or the current literature was suggesting that periodontal disease could affect erectile dysfunction. And that was a pretty embarrassing question for me. I'm thinking I wasn't really used to talking about that. So what I learned is that gum disease bacteria affect the endothelium. And I know your audience knows what the endothelium is and how that functions. And they've seen this picture from you before. And this is a picture that describes all the different ways that gum disease bacteria can affect the heart disease process. So part of it's with lipids, part of it's with smooth muscle, part of it's with the endothelium, part of it's with plaque buildup. But there's a multi-dimensional effect that these mouth bacteria have on the system. What I didn't think about was what's the mechanism of action on the endothelium and what happens on the endothelium and how do mouth bacteria relate to that. And that's what we'll start to get into. And I also knew that gum disease causing bacteria would affect the different biomarkers that we have available that we can measure. And these are things you measure, Ford, when you ask patients to get a pre-consultative workup, if you will. You might ask them to get a HSCRP, and you might ask them to get an LPPLA2. I know this is part of your blood panel. And one of the biomarkers that we look at is ADMA, and that's a precursor to nitric oxide. If people have, or it's a competitor for nitric oxide, and if that's elevated in the blood, then I might be suspicious that nitric oxide could be in short supply. If nitric oxide is in short supply, I got to start saying, why is that? And could the mouth be part of that?
Before we do, I'll just do a quick plug for a lot of folks. Docs just are not going to get that. As you know, cardiovascular inflammation panel is something that most docs don't know, don't understand, don't know how to order. And quick and easy way to do that is with us. We have a webinar on insulin resistance where you get something similar. You get a OGTT with insulin response similar to the Kraft insulin profile, and you get the cardiovascular inflammation panel. So you get two of the critical studies that, again, docs just don't know how to order.
So these are the questions, and I help dentists try to understand this. What is nitric oxide? But the big one for me is, how do we make it? Where do we make it? How do we make it? And then can you measure it? I mean, if you can measure it, then maybe we could do something about it. And then what's the lack of it mean? And that's something, Ford, that you can probably address better than I can. But then what I wanted to know is, if you don't have enough, if we don't make it the right way, could you just buy it? I mean, could you just replace it some other easy way? And that's kind of where this is leading to. So as we move ahead and look at what it is, it's this signaling molecule that really does so much in the cardiovascular system. And Ford, you might even be better to deliver this particular slide. But what I wanted to do is digress just a little bit. And I went to the author of this book that wrote this book called Functional Nitric Oxide Nutrition. And I thought, if I wanted to find out about nitric oxide, maybe I should go and, see what happens. Your group knows that I've studied a little bit of functional medicine. And I was at a functional medicine conference, and he got up on the stage and he said, you could be ruining your nitric oxide production if you're using mouthwash. Well, I use very harsh mouth rinses in rebalancing my patient's bacteria levels. Sometimes I have to use really harsh mouth rinses, and I'm sitting in the audience and I'm thinking, I do this every day. Am I hurting somebody's ability to make nitric oxide? And that's where this got involved, because what he went on to say is that every chronic disease that we deal with starts with the loss of the signaling molecule that does so much great work on the endothelium, keeping the endothelium healthy, and it has a big effect on our body. And the next slide is a little bit of a breakdown where it talks about how important the nitric oxide is. And you can go ahead and advance that one.
Before I'll do that, I'll just comment on item D, as in David. The molecule was only discovered in the late 70s and early 80s, previously called endothelium-derived relaxing factor. That was some of the work that the docs did receive that Nobel Prize. That Nobel Prize was covering this work over the past couple of decades. And the reality was, it wasn't so much the endothelium relaxing factor, because the endothelium can't relax. It's just an endothelial. It's a tissue that doesn't relax or otherwise. But what does relax is the media, the smooth muscle that underlies that endothelium. And you saw that in one of our first pictures where that endothelium was all bunched up. It was bunched up because the surrounding artery muscle, the surrounding media, the smooth muscle was bunched up and was contracted.
Yeah, so in his book, he has this comment about the top 10 causes of death. And, we can see it's heart disease, cancer, respiratory diseases. And we probably won't get to it today, but there is an element of COVID that plays into this story as well. Drugs and stroke and Alzheimer's and diabetes. It's the stuff that your group knows really well. And nitric oxide has some mechanistic activity in each one of these diseases. And this is the idea. And again, just to let people know how serious some of these physicians are about this, again, I contributed a chapter into this integrative cardiovascular medicine textbook that was edited. Mark Houston was the organizer and editor of this, and Nathan Bryan, who wrote this nitric oxide nutrition book, he wrote a chapter in this book as well. And so I've had a chance to rub shoulders with him a little bit and talk about this science. And, it's out there and we can measure it. We just have to look closely for, like you're looking at your patients on these blood screens. So it's really quite interesting. Talk about how it's such an important molecule, why it's hard to measure. It's the gas. It comes and goes almost instantly. So you need a common supply of it. And where we typically get it is from the foods we eat. However, the typical American diet, we might not have the kind of foods that are the ideal precursors for nitric oxide. And we'll talk about that. Also, we learn that as we age, it's not made by part of our body. It's made in the mouth and it's made in our blood vessels. But as we age, we stop making it, or we don't make it as efficiently as we age. And that kind of makes sense. People might understand that. And they also now have figured out how to reverse the process, or how to augment the lack of it to undo some of those effects. And before we get into the weeds forward on this whole process, I have had some patients with Raynaud's, Raynaud's, which is a vasoconstriction of the periphery vessels. And they have told me they've had remarkable change after just taking a supplement. And we'll decide if a supplement's right for you or not right for you, because there's ways we can measure it. So as we move ahead, I just want to maybe get to the two ways we make it. One of the ways we make it is in the endothelium. The endothelium is a manufacture through this, call it the enos-arginine pathway. And Ford, maybe I'll just let you take that little part a little bit and tell me what this enos-arginine pathway is about.
Sure. There's an enzyme, and it's called enos. It's like so many things in science. It's an acronym. It stands for endothelial nitric oxide synthase. So that enzyme takes precursors like L-arginine and citrulline. Remember, we mentioned those earlier, and those are a couple of my most popular videos for this reason, because of that topic. It takes those precursors and forms nitric oxide with those. And again, that gets us back to the whole nitric oxide story.
And so a couple things that were mentioned in Nathan's book is that as we age, we lose our ability to make it. So that's a big concern. The other concern are the large population of people that have a mutation of the MTHFR gene, and that can be found out pretty easily. And I know you've done some work on that, Ford, but I don't know where you are on that particular story.
It's a great point. It's also a supplementation story as well. Over half of us have some significant inability to methylate, and it's methylation. Many people recognize this term by the term methylation. Just very briefly, another quick bunny hole, and we'll go down it for a few minutes. So oxidation, the difference between us and yeast is that yeast can't really oxidize glucose, for example. It gets 6 units of oxygen out of glucose. We are able to get 36 units of energy out of glucose compared to the 6 that the yeast to get. Why? Because we carry oxygen, hemoglobin. We oxidize things. Now, the chemists, the engineers, the mechanics will call oxidation rust. It's a combination of oxygen with iron, classically, but in our body, we use oxidation to pull energy out of a molecule like a glucose molecule or a fat molecule. And that's how we're able to get so much more energy. But, it's like any other very effective way of burning and creating energy, like a furnace. And in fact, one of the most common theories about aging is the Mitochondria Theory. The mitochondria are considered the furnaces of the cell. Well, if you've got a cell, a furnace, that's exactly where this occurs. In the mitochondria, you have this oxidation process. Heart cells, for example, may have hundreds to thousands of mitochondria per cell, whereas other cells that don't use a lot of energy, like some bone cells, cartilage cells, things like that, have less than a dozen. That's the furnace. That's where the energy is derived for use of the cell. Well, have you ever looked at a new furnace and compared it to a 60-year-old furnace? 60-year-old furnaces have holes in them. The iron has been oxidized or rusted out in a lot of places, and they just don't work as well. Now, why did I go down all that bunny hole when Doug started talking about methylation? Well, it has to do with the basic chemistry. The opposite of oxidation is reduction. Reduction is adding a hydrogen atom. We don't really do that. Medically, in terms of our bodies as humans, we add an entire methyl, which is a carbon plus 3 or 4 hydrogens. We don't add one hydrogen, we add a methyl group. Now it's beginning to complete the circle. There are enzymes that we use in our metabolism to clean up all of that oxidation, all of the burnout rust that's created by our energy deriving mechanisms. It has to do with reduction, which in our world, our metabolism is actually accomplished through methylation. The simple way, Doug mentioned you can get tests for this. The simple way to deal with this is to take a methylated B vitamin complex, because the B vitamins are the vitamins that are very much involved with that. Doug, I do have a methylated B vitamin complex that I offer. It's more of a medical grade. It's got a little bit higher level of one of the B vitamins. So I think that's probably enough to cover on that. Any other comments before we move on?
No, I just think that, we learned that if you have this MTHFR mutation, that it also impairs your ability to make nitric oxide cleanly. So there were really two things. There was age, and then there was a genetic component that could be preventing proper production as well. And then the next pathway is very interesting, and this is where I come in.
If you listen to some other YouTube docs, specifically Z-Dog, MD, he'll say, yes, methylation exists, but it doesn't matter. Well, it doesn't matter to somebody like him. He's a hospitalist, an intensivist. He's dealing with people in the intensive care.
Mm-hmm.
But if you look at the science, that's not at all true. People like myself and the other over 50% of the population that have a methylation problem, we start getting problems earlier. Tissue breakdown, for example, problems with our eyes associated with methylation and early prediabetes. So it is a serious issue. The science is very clear about it. And as you've mentioned, yes, I've covered that in some other areas.
And this is the other area that I find very fascinating, and I've learned about it recently, but it comes from our diet. And it's the story about how dietary nitrates become turned into nitrites as the saliva in the teeth start to chew up the food. And that nitrate, some of that nitrite is immediately converted by healthy bacteria that live on the tongue. And so what you see on the slide is a plate of green leafy vegetables and some foods. It mixes with the bacteria in the tongue and the saliva, which is the first phase of digestion. And then some of it gets made into nitric oxide right then and there. But the other nitrite gets absorbed by the body. And what it usually takes is some appropriate stomach acid. So Ford, later on in our discussion, this would be a place to discuss people who take PPIs or antacids if you don't have the right stomach acid. And then it gets reabsorbed into our system and it sits up in the parotid gland. And it sits up in the parotid gland as nitrite-rich solution that immediately squirts out. And now it doesn't have to be chewed, doesn't have to be digested, and the bacteria on the tongue can use it much more readily. There's an enterosalivary pathway to making nitric oxide, and it happens from our commensal organisms, which means our healthy organisms. Now, here's the rub for me. When I have somebody that has a gum disease or somebody that has a high cavity rate, we know from doing bacteria studies, if your dentist doesn't do bacteria studies, you'll never know this. But we know from doing bacteria studies that they have a very high disproportion of bad, unhealthy bacteria. And what it does is it squelches the healthy commensals anyways. So when I see somebody who's diseased, I know I have to fix the disease or rebalance the disease-causing bacteria, and then we can return to this state of health. So in the beginning of my treatment, I'm willing to make some sacrifices of some of the bacteria But in the long term, if I'm healthy and I'm rebalanced, we want to do as little as possible in the mouth. And so this dietary pathway, and it's how it happens, starts on our tongue, continues on in our gut, and then gets resecreted by the parotid glands, where the saliva is further broken down into nitric oxide. And the diet pathway gets to be more important as you age because you lose the ability to make it other ways. So that's the idea.
So if I could speak to this first bullet under number 2, this really has something to do in terms of COVID-19. And here's the issue, and it has something to do with the practical question about should I supplement or should you supplement? Our gut microbiome further converts nitrates to nitrites. However, we need normal stomach acid. With appropriate acid concentration, nitrates from fruits, dark green leafy vegetables, and beets get converted to nitrites. Since I became pre-diabetic, 5 years ago, 7 years ago, I started slowing down on fruits because, apple juice, apples, grapes, huge sources of fructose and problems for pre-diabetics. But I practically lived. Dark green leafy vegetables were a major part of my diet until COVID-19. So we've struggled in terms of figuring out, okay, what is a safe, in terms of COVID, way of getting dark green leafy vegetables. And beets is another issue. Beets, as you know, beets are have been used, sugar beets, you may have heard the term. A lot of those are used as a source of sugar. So understanding that and getting a little bit more focus on that in the age of COVID, I've ordered some beetroot, and I am going to be gearing up on that. Doug, as you know, you sent me some samples on this Neo 40. I've tried that. Not entirely sure how I'll know if it's working.
This was something else that I just want to remind people. I haven't been on your program, Ford, and talked too much about sleep apnea. But another place that we make nitric oxide, just not to be overlooked, is in the paranasal sinuses. And this is one of the reasons why we really encourage people to learn how to nasal breathe and to make sure they can nasal breathe. And it means if they can't nasal breathe, then we want an ENT to evaluate, and we want to figure that out. But we actually, and I see there's already a question about the oxygen advantage. That's a book that's written about breathing and airway, and we're learning more and more about the airway and the respiration component. I think you talked about respiration a few shows ago, where we talk about ideal respiration and what we need. And it was part of how COVID affects the lungs. But we need nitric oxide, and we need this to have proper respiration, the CO2 balance. And so it's interesting because the sinuses are very important. And I just want to make sure I go on the record as identifying this as another place where we make nitric oxide and that people use. And we actually encourage lip sealing or mouth taping at night. We could come back and talk about that whole piece. It's another interesting part of dentistry.
Yeah, may not know. About 2 years ago, I did a long series on sleep, and portions of that had to do with sleep disordered breathing, but there's a lot more to, it's a huge, huge topic in terms of our health.
Yeah, and then my friend down the street, Dr. Joel Kahn, he wrote a book called The Whole Heart Solution. And I didn't even put 2 and 2 together, but he has a recipe on page 87. It's called Natural Nitrates on a Plate. And I'm like, Joel, why do you have I know you're vegan, and I know that you do a lot of work in this space, but I said, what's the significance of this particular recipe? And he said, this recipe is a nitric oxide producing powerhouse. That's why I have it, on the slide. So why I'm saying this, Ford, is because when I listen to your channel, when I work with other professionals and I become aware of a particular topic or an idea, all of a sudden I start to recognize that I've seen it before, or maybe I've heard it before, but it didn't make so much sense to me. So I put this in here just in part of being balanced. I mean, we're not the only ones talking about this. And once you start to recognize it, you'll see it around you in other places. And so this probably is a good place or to just throw this concept out there, because this is where I felt like I might be doing my patients a disservice. And this is a paper that mentioned if you don't have the right oral microbiome and you're not producing nitric oxide, could you be affecting someone's blood pressure? And this is now where the endothelium, erectile dysfunction, blood pressure, vascular disease, Raynaud's, all these different things start to come into play. And I thought, as a dentist, if I could have some simple way of measuring, which I'd love to get to next time, and it's easy, and even for the consumer to be able to do it, it would really lend clarity about should I or shouldn't I, and is what I'm doing having an effect. So this is a big piece because we know how many people have hypertension. We know how many people, even on blood pressure medication, aren't getting to the end point, even just with their medication. And we know that this nitric oxide production, oral bacteria, the effect on the system may be a contributing factor, especially when I'm trying to get people to go from disease to health. Should I really be doing something for them then during that time when they're maybe most vulnerable? That's the idea. And so when we come back for it and we get into it, we'll look at the literature about systemic hypertension and looking at and managing hypertension and considering the oral microbiome was not even on my radar several years ago. So it's something that I think owes just a little bit of time.
I agree. And to this point in the middle, in some age groups, the risk of cardiovascular disease doubles for each increment of 20/10 millimeters of mercury of blood pressure, starting as low as 115/75. You may cover this later. There's a number, something like 10/5 in terms of the impact of beets, for example, on blood pressure.
Yeah, it's coming up. It's pretty quite interesting.
You know, if that can double your blood pressure and you can get half of that just by eating beets, yeah, there's got to be something significant there. Continue to get great feedback regarding the webinars, and here's why. You know, on the internet, when you hear a webinar, you expect for somebody to try to sell you something. We're not doing that. We're trying to tell you something. People are coming in with their labs from Quest, inflammation panel, OGTT, insulin survey response, and then they're finding out, do I have inflammation? Do I have insulin resistance? And where does that fit in terms of other folks? We're getting ready to start one for CIMT as well. So again, people are really excited about finding out their own status. Looking forward to seeing you there. Thanks.